You have had a productive day and a healthy one, and I would like to welcome you back from the President's speech. So, on today's program, we bring you the latest updates for the news from Uganda and around the world. So, we look at how Ugandans marked Matters Day amid the Ebola prevention measures efforts to strengthen Uganda's Ebola response through international support, and also a new oxygen plant commissioned to improve emergency healthcare systems and services. And also the World Health Organization's latest warning on unsafe food and a health alert issued ahead of the 2026 FIFA World Cup. And because it's a Thursday, we are coming to the end of our week here on TV1. I would like to thank you for tuning in and thank you for joining us today. So let's just get into our health news for today. Now, Ugandans yesterday marked Matters Day in historic, unusual ways. Celebrations were held at parish and diocese levels across the country, instead of the traditional national gathering at Namugongo. So the decision followed government measures aimed at preventing the Ebola spread after authorities suspended the annual mass pilgrimage that normally attracts hundreds of thousands of worshippers from Uganda and across the world. So for the first time in many years, the famous Catholic and Anglican martyr shrines at Namugongo did not witness the massive crowds usually associated with June 3rd celebrations. Instead, believers gathered in their local churches, cathedrals, and dioceses to commemorate the faith, courage, and sacrifice of the Ugandan martyrs. Despite the cancellation of the national pilgrimage, the day remained a public holiday, and thousands of Christians across the country attended special prayers and services under the theme, Christ is alive in you and in me. And at Namugongo, only limited prayer activities were allowed under strict health guidelines, where worshippers who attended were screened thoroughly by health workers, sanitation measures were intensified, and religious activities were scaled down to reduce the risk of the disease transmission. Now, health officials remained on the site throughout the day to monitor compliance with Ebola prevention measures. Now, religious leaders used the occasion to call for unity, responsibility, and vigilance as the country continues to respond to the Ebola outbreak. During the celebrations at Namugongo, Archbishop Emeritus Augustine Kasuja praised the efforts being undertaken to protect public health and also expressed the solidarity with communities affected by disease and hardship. So he highly encouraged Ugandans to continue praying for those affected by the Ebola and for healthcare workers serving on the front line of this response at large. Meanwhile, the Archbishop of a Church of Uganda, Stephen Kazimba Mugalu, used the occasion to urge government to strengthen a healthcare system. And he also renewed calls for the establishment of a national health insurance scheme, saying that many Ugandans continue to struggle to access affordable healthcare, particularly for serious illnesses such as cancer and chronic diseases. Archbishop Kazimba commended the Ministry of Health for its ongoing efforts against Ebola, but emphasized the long-term investment in healthcare are necessary to ensure that all Ugandans can access quality medical services when they need them. Health experts have welcomed the decision to decentralize this as decentralized this Matters Day celebrations, saying it demonstrated how public health measures and religious observance can work together to protect communities during disease outbreaks. So as Ugandans continue monitoring the Ebola situation, health authorities are encouraging the public to remain vigilant, practice good hygiene, report symptoms early, and follow all Ministry of Health guidelines. So while the year's Martyrs' Day looked different from the previous years, many believers described it as a powerful reminder that faith, unity, and protection of life remain at the heart of the commemoration. And that's it from yesterday's health update. Now, moving on to our next story for today, access to life-saving medical oxygen has been received and a major boost following the commissioning of a new oxygen generation plant at Hope Clinic by the Rotary Club of Nkonge Lukudi as its partners. So the oxygen plant, valued at approximately 128 million Uganda shillings, is expected to improve emergency healthcare services and strengthen the clinic's ability to care for patients with serious medical conditions that require oxygen therapy. And speaking during the commissioning ceremony, Rotary leaders described the project as a significant investment in community health and practical solution to one of the most important needs in modern healthcare. They noted that medical oxygen is not just an equipment but a critical resource that can mean the difference between life and death for patients experiencing breathing difficulties and other medical emergencies. Medical oxygen is commonly used in the treatment of respiratory illnesses, severe infections, asthma attacks, pneumonia, and trauma-related injuries, also surgical emergencies, and other conditions that affect a person's ability to breathe normally. Health experts said that the importance of a reliable oxygen supplies became particularly evident during the COVID-19 pandemic, when many health facilities across Uganda and around the world struggled with shortages of oxygen needed to treat critically ill patients. The newly installed oxygen plant will allow Hope Clinic to produce oxygen on site, reducing the dependency on distant supplies and ensuring a more reliable supply during the emergencies. Previously, health facilities often had to transport oxygen cylinders from other locations, a process that could be expensive, time-consuming, and challenging during urgent situations. Rotary officials say that the project is designed to improve patient outcomes while enhancing the clinic's overall preparedness to report to medical emergencies. Health workers at Hope Clinic have welcomed the development, saying it will strengthen their ability to provide quality care and support critically ill patients who require immediate oxygen therapy. They explained that oxygen remains one of the most commonly used treatments in emergency medicine and intensive care, making its availability essential for effective healthcare delivery. But beyond benefiting patients at Hope Clinic, the facility is expected to serve the surrounding communities by improving access to critical healthcare services and increasing the region's emergency response capacity. Now, the project forms a part of Rotary's broader commitment to supporting healthcare and community development through investments in medical infrastructure, disease prevention, and maternal and child health, education, water and sanitation programs, all of them together. Now, Ugandan healthcare advocates said that initiatives such as this help strengthen Uganda's healthcare system by ensuring that communities have access to the equipment and services needed to save lives and improve health outcomes. For residents in the area, the new oxygen plant represents a more than an infrastructure project. It is an investment in safer, faster, and more effective healthcare to generations to come. Now, we would like to thank the Rotary team for the area for doing such an important job on providing these items to our healthcare systems and saving many lives. Now, moving on to our story for another story for today. The World Health Organization, commonly known as WHO, has raised alarm and new findings showing that unsafe food continues to pose a major threat to global health, causing an estimate of 866 million and 1.5 deaths every year. Now, the report highlights that children are among the most vulnerable groups, and although children under the age of 5 make up only about 9% of the world's population, they account for nearly a third of foodborne diseases worldwide. According to WHO, children under 5 are almost 3 times more likely to become ill from unsafe food than older children and adults. Many of these illnesses are caused by contaminated food, carrying harmful bacteria, viruses, and parasites that can lead to severe diarrheal diseases, dehydration, and other life-threatening complications. So the organization also warns about these dangerous chemical commitments found in food, including lead, arsenic, and methyl mercury. These substances can damage the developing of young children and can lead to lifelong learning and also developmental of their life and also neurological problems. Health experts say that food contamination may occur at many stages, including farming, food processing, transportation, storage preparation, and also serving. So the report reveals that biological hazards such as bacteria and viruses are responsible for the most foodborne illnesses. However, chemical contaminants account for majority of food-related deaths worldwide. In fact, WHO estimates that chemical hazards are linked to nearly 3/4 of all deaths associated with unsafe food. And beyond the health consequences, unsafe food also has a major economic impact, and the organization estimates that foodborne diseases result in hundreds of billions of dollars in lost productivity each year as people miss work, seek medical treatment, or care for the sick family members. So the report also highlights that the significance and also inequalities across different regions of the world. Africa and Southeast Asia carry the heaviest burden, accounting for nearly 3/4 of all foodborne illnesses globally and approximately 6% of food-related deaths. Health experts said that limited access to clean water, proper sanitation, food safety systems, and healthcare services contribute significantly to the higher burden seen in low and middle-income countries. The World Health Organization is urging the government to strengthen food safety measures through improved hygiene, better food handling practices, stronger environmental regulations, and increased monitoring of food production systems. And for individuals and families, experts recommend severe, simple, but important food safety practices. And these include washing hands before preparing food, thoroughly cooking meat and other animal products, washing fruits and vegetables before consumption, storing food at safe temperatures, drinking clean water, and avoiding food from unhygienic sources. WHO officials say that food safety is not a concern for government and health professions, but a responsibility shared by everyone involved in the food chain, from farmers and food processors to vendors, plus the consumers. So the report has been released ahead of the World Food Safety Day, which is commemorated on June 7th under the theme From Burden to Solution, Safe Food Everywhere. Health experts hope that the findings will encourage greater investment in food safety systems and help reduce the millions of illnesses and deaths caused by contaminated food every year and around the world. Now, moving on to our final story for today. So as excitement builds ahead of the 2026 FIFA World Cup, health authorities are reminding travelers and football fans that protecting their health and their lives should be just as important as supporting their favorite teams. So the Pan-American Health Organization, our regional health agency working with the World Health Organization, has issued a public health alert over rising cases of measles ahead of the tournament, which will be hosted by the United States, Canada, and Mexico from June 11th to July 19th. Health experts said that the combination of increased international travel and ongoing measles outbreaks could create conditions for disease spread more rapidly among visitors and local countries and communities. Measles is one of the most contagious diseases in the world, so it spreads through the air when an infected person coughs, sneezes, breathes near others. Symptoms commonly include high fever, skin rash, cough, running nose, red eyes, and general body weakness. And in severe cases, especially among young children, measles can lead to pneumonia, brain inflammation, and even death. So according to the health authorities, more than 20,000 measles cases and 25 deaths have already been reported across countries in Americans this year, representing a significant increase compared to the same period the last year. And most of the reported infections have occurred among people who were either unvaccinated or whose vaccination status was unknown. So for Ugandans planning to travel abroad for the World Cup or other international events, health experts are advising travelers to ensure that their routine vaccinations are up to date before they depart. And parents are particularly encouraged to confirm that children have received all the recommended childhood immunization, including the measles vaccine. And health officials say that vaccination remains the safest and the most effective way to prevent measles infection and reduce the risk of the outbreaks. Travelers are also encouraged to familiarize themselves with the symptoms of measles and seek medical attention immediately if they develop signs of illnesses during or after the travel. So upon returning home, anyone who experiences symptoms such as fever, rash, should inform health workers about their recent travel history to help facilitate early diagnosis and also treatment. And also public health experts note that major international gatherings such as sports events, conferences, and religious pilgrimages often increase opportunities for infectious diseases to spread across borders. Now, the alert serves as an important reminder that disease prevention remains a shared responsibility in an increasingly connected world we are having today. So, as football fans prepare to celebrate the world's biggest sporting event, health authorities say that staying protected through vaccination, also practicing good hygiene and seeking medical care when necessary can help ensure that memories brought home of great matches, they are memories, good ones, and not the preventable illnesses. And to our dear viewers, that concludes today's health news bulletin. So, thank you for staying with us and thank you for tuning in. And we shall meet again tomorrow from 4 to 5 p.m. I have been Kaites Elizabeth, and have a great day.